Chairman Mark Kern and Barb Holt from the Health Department. Barb, you have our numbers for today.
I do, thank you. Welcome everyone. Good afternoon. Today's stats, we include 212,005 tests we've done so far in St. Clair County. That's an increase of 749 from yesterday. With that, 116 were positive. A little better than yesterday. However, our daily positivity rate still is 15.5%. Again, very, very high. Those positives are males and females under 10 years of age as well as up into their 80s. So we have total that have tested positive 21,541 and a total of 190,464 that have tested negative. Total deaths still remain at 330. For those that have completed the 10-day isolation requirement period, 19,449. Statewide totals, we've tested 13,482,117. That's an increase of 4,469 since yesterday, for a total positives that we've tested 979,821. Unfortunately, the state of Illinois has several deaths to report since yesterday, 81 additional deaths throughout the state, for a total of 16,755 that have died due to COVID-related illness throughout the state. Hospitalization numbers, they still remain very high. St. Clair County-wide hospitals, we have 125 COVID-related patients, with 12 of those on ventilators, and region-wise, again, still very high, 194 patients, and 16 of those are on ventilators. For congregate care centers updates, we have one additional case at Knollwood Retirement Center in Caseyville for 11 cases and 1 death. We have one additional case at Brightly Senior Living for a total of 23 cases and 1 death. And finally, we have one additional case at Cedar Trails in Freeburg for a total of 13 cases and 0 deaths. Also, again, we have several testing sites available. Monday, Tuesday, Wednesday, we're at our St. Clair County Services Facility building at 330 West Main from 8 to 4. Also, we have St. Clair Mall is open 8 to 4, 7 days a week. And let's see, on Tuesday, we will be at the Clyde Jordan Senior Center from 8 to 4. That's at 6755 State Street in East St. Louis. So those are a couple for the beginning of this week. And I will now turn it over to Chairman Kern.
Great.
Thank you, sir.
Thank you, Barb. Record hospitalizations today.
Yeah.
That's, as we said, the high positivity rates, they're a leading indicator that really showed us that this was going to happen. So that's why it's important we get those positivity rates down to make sure that the hospitals don't fill up to a point where patients can't be handled. So,
Exactly.
the zip code report today, we'll start with 62201 is up 1 to 460. 62203 is up 4 to 516. 62206 is up 4 to 1030. 62207 is up 4 to 474. 62208 is up 14 to 1237. 62220 is also up 14 to 1479. 62221 is up 14 to 2052. 62223 up 7 to 1299. 62225 up 1 to 105. 62226 up 9 to 2327. 62232 up 1 to 685. 62239 is up 6 to 334. 62240 up 1 to 108. 62243 up 5 to 540. 62254 up 4 to to 622. 62257 up 3 to 244. 62258 up 7 to 776. 62264 up 2 to 251. 62269 up 11 to 2,380. 62282 is up 1 to 46. 62285 up 1 to 417. 116 new positives, 749 tested, brings our daily county positivity down today to 15.5%, which also means the 7-day rolling average is down today also at 14.1%. Being down at really no consolation, these numbers are just way too high. The regional positivity, the state takes the other counties in the region, merges them together. We come up today up to 13%. Bond County is at 5.4% today, 5.4%. Clinton County is at 13.1%. Madison 17.2%. Monroe 15.5%. Randolph 5.4%. St. Clair 17.2%. and Washington County, 28.6% today. Her numbers are high, they're growing. I'm worried that during the holiday season that we're going to see an exponential increase in the numbers, so we need to prepare ourselves for that. There's still plenty of chance for people to wear their masks, wash their hands, watch the social distance, stay out of crowds now. Let's all hunker down until we get this vaccination out in the general public.
Well, and it's, we'll talk about that as soon as we get through with our question and answer. We have quite a few of them come in today, but you're right. The fallout from the holidays is not looking good at all. And, you know, we're, 8 days from Christmas, but we had New Year's right here. And if these numbers are the indications, you know, a few of the followers today with their remarks, you know, this isn't about a popularity contest. This is about public safety. This is about people's lives and the hospitals, highest numbers we've seen here in the county. So we'll talk about that in a few minutes. But Brian, you got the questions that came in this week?
I do. We'll start with Director Holt with quite a few health department questions that have come in. The first one, I'm gonna go through several questions that have come in about the vaccine, and then we can kind of give the answers to all these as we work through them. So questions that came in today about the vaccine was, how will seniors over 70 not living in an assisted living or nursing facility be notified when the vaccine is available? The second person said, I work in healthcare and get COVID tested twice a week. Last week there was a vaccine consent form they had to fill out, but we were not allowed to date it or fill out the yes or no questions, such as if we've had reactions to viruses, do you have autoimmune disease? Several questions we were told blank. We also had to provide our private insurance information and sign it. Next person, my husband's 98 years young. When and where will he be able to get vaccinated? And will there be a list? When can we expect educators to receive the vaccine? What is the reality as far as 65 or older getting vaccine? Another person says, we've been trying to find out why there's a delay of 2 to 3 weeks from the first vaccine to the second one. Why not a week? What happens if you don't get it within the right time? My 20-year-old daughter has Crohn's disease and is immunosuppressed because of her medicine. How will we know when she can get the vaccine? When will teachers be eligible? My mother is 83 with medical issues. When can she get the vaccine? Per CDC data, Illinois has received over 403,000 COVID vaccine doses, but has only administered 170,000. What are the numbers for St. Clair County, and what is being done to increase the urgency for administering the vaccine? When will COVID vaccine be available for non-essential workers, and would it be Pfizer or Moderna? When you get both doses of COVID, how long does it take to make you immune? How many vaccines have been delivered to St. Clair County, and how many have been administered? And the last vaccine question says, I've read that people with underlying health conditions will qualify for the vaccine in 1B, and I've also read 1C. Which is correct, and who decides, the county or the state? So a lot of questions about the vaccine today.
Absolutely. So we are following federal guidance from CDC as far as the tiers of who receives the vaccine first. We're in Phase 1A, which is for the hospitals and their workers as well as the long-term care facilities. Those are the target populations for the first rollout. This vaccine, regardless if it's Pfizer or Moderna, which type it is, you will need to have 2 shots. The first one for Pfizer is for those that are 16 years of age and up, and then 21 days or later, you are to get your second dose. So, same way for Moderna, it is a 2-dose series, but these are for 18 years of age and older, and you get your second shot 28 days or later for those who receive the Moderna. So it's very important that we keep track of what type of vaccine you get, when you get it, and then making sure that how it's being rolled out to the federal government and to the state, that we have, if you get Pfizer week 1, that 21 days later, we have that sufficient amount of Pfizer for the second dose for individuals. Same way with Moderna. For both vaccines, it is estimated to say, well, we think you might get about 50% immunity by getting the first dose. And then as it's been tested, one of the questions say, well, why isn't it a week later? Typically vaccines take about 2 weeks to really get into your system and develop immunity within your own antibodies. So research has shown for these particular vaccine, Pfizer is best to give the second dose 21 days or later, and Moderna is shown best to give the second dose 28 days or later. And absolutely we recommend getting both doses, and then you'll boost your immune system to get about 95% efficacy, or that you will have that type of immunity for the vaccine. So how will you know when it's your turn? Again, we're looking at those priority populations in 1A. 1B will include those 75 years of age and older, as well as our first responders, the police, the fire, those essential workers, as well as educators and teachers. How will we get this information out to the public of when it's available and where it's available and what groups? We will push this out through all sorts of media outlets. We'll have it on our 3:30 shows here. We'll have it on in the local papers. We'll have it on social media outlets. We'll ensure targeted populations may receive it through their normal newsletter. We're working with senior citizen centers as well as bus services to help us coordinate getting elderly folks to the vaccine clinics. So a lot of that information will be coming out on how you can sign up to get a ride to be able to come to the vaccination clinics. And then once we do have the clinics, those will be set by appointment. The vaccine is in limited supply, so we will only get a limited shipment to be able to provide to those parties within that phase. And we won't be able to provide everyone in that phase right off the bat. Again, we get limited supplies, we will use that up, and then we will provide the vaccine as we receive it. Again, this is coming down from the federal government, and each state is allocated so much, and it's being distributed in a sequenced time frame. So as soon as we finish up 1A, we will move to 1B and push out this information to the general public. And again, then we'll offer these appointments, and we'll have so many appointments per day, and handling of this vaccine is very critical. The Pfizer is a frozen, ultra-frozen type of vaccine, where the Moderna is refrigerated. Regardless which one we have, we need to make sure we handle it properly too. Let's see, a couple of the other questions. The second question was a person that asked about, they filled out that information for a healthcare center and told to leave certain things blank. I would check with your supervisor about that. The vaccine itself is free from the federal government. However, individuals can charge an administration fee, and that's why they may ask for your insurance card. There will be no charge to individuals for the vaccine, and there will be no copay whatsoever. So that is how it's rolling out. But the provider, the person administering the shot, may use your insurance card to request an administration fee. Again, anyone with any type of immunocompromising illness, allergies, Crohn's disease, any medical issues, please check with your private provider. They know your medical history or your parents' medical history, whoever you're checking on, the best to be able to say whether or not that individual person should or should not receive the vaccine. And a couple of other questions. How many have been distributed in St. Clair County? We're awaiting those numbers from IDPH. We've had about over 5,000, but there's more than that because it's starting to roll out to the long-term care facilities through the CVS and the Walgreens store. So we don't have those exact numbers, but Department of Public Health will be posting those per county in the near future. So we'll have more of that information for you. As far as when it will be available to non-essential workers, that will be phase 2. So there's phase 1A, which were for the hospital long-term care, phase 1B, which are those essential workers and those individual 75 years of age and older and the educators. And then phase 1C is for people that are 16 to 59 years of age with health conditions and other essential workers such as food service, shelter, housing, construction tellers, and bank tellers, bank providers, communications, those other public health workers are in 1C. And then finally, phase 2 is the rest of the general population. So again, these guidelines were issued by CDC and IDPH, and our local health department will be following them. And then finally, there was a question about if you have underlying health conditions. Again, ages 16 to 59 would be 1C, but 75 years of age and older would be 1B. This information is all available on the IDPH's website, Department of Public Health website, and it lists all these guidelines. This is phase 4 or version 4 of the vaccine plan. And again, dph.illinois.gov, and just go to vaccinations and it's posted there of all the guidelines and who's in which category. So any other things about vaccines that I missed out of any of those questions?
Just one question on here. The med car drivers, the transport people to the dialysis and them, do you know what phase they're in?
Let's see. Essential transportation is public transit workers are in 1B.
Okay, 1B.
1B.
Very good.
Okay, we got several questions also as it relates to schools, so I'll kind of do those as a group here as well. The first person said many schools are reopening for in-person instruction within the next few weeks. When asked previously, you stated these decisions are left to individual districts and you work closely with them. How exactly are you working with them? What does this type of work look like? Somebody followed up with the new variant that seems to strike children harder. Do you recommend sending kids back to school for in-person? In a past episode, you mentioned that school districts are able to decide for themselves when they should be remote and when they should be offering face-to-face. However, in the fall, the health department did make a recommendation for schools in the county to go remote. The only thing that has changed since then is that the numbers have gotten progressively worse, and we now see children being hit just as hard. Will you make a recommendation for remote learning? If not, why? And the last one about schools said, as some school districts in the county prepare to bring back every student every day, one can be somewhat concerned about the loose guidelines set forth by the Illinois State Board of Education and IDPH when it comes to social distancing in a classroom. 6 feet is the gold standard, but some schools, in order to accommodate bringing everyone back, are encouraging teachers to space students 3 foot or less apart. What are the major ramifications of going from 6 foot to 3 foot? And should educators and parents notify the health department if students are being seated 3 feet or less from each other?
All right, schools there, and yes, in the past, we had the very beginning of the school's year in summer for the fall session, we recommended to go remotely for a month. We didn't know exactly how we were going to handle the isolation and quarantine in the schools, along with teachers and the workers and we were able to work out a system coordinating with the schools, with the school nurses, with the superintendents, the principals, and point of contact specific folks that several of the schools took the courses on how to do contact tracing, so they understood what we would be looking for if there were positive cases within the school. So with all that said, the first month kind of helped everyone understand how this worked, understood what it meant to have the social distancing and the State Board of Education rules to be put in place, and then they slowly started opening the doors to allow the students in part-time or every other day, along with remote learning, and we learned a lot. It was a new virus, and we're still learning a lot about it. As far as the schools themselves, yes, they are the regulatory authority to say if we will have total in-person, a hybrid of that, or remote learning, what's available. That's up to the schools, the superintendents, and those boards. And as we said in the past, each school is a different size, shape, and how that all those recommendations can be accomplished. I know we have received several questions in the past that children are being put only 3 foot away instead of the 6 feet away. We highly recommend the 6 foot. It depends on, again, each school and the shape of the school and the size of the classroom. I would discuss that with the superintendents and the principals, as well as your school board, to make sure that these recommendations from Department of Public Health and IDPH are followed. Some of the ways that we work with schools and ROE, and this is a recent example, as you know, as we said earlier, in Phase 1B, teachers will be part of that group available to get vaccines. So we're working with the Regional Office of Education to be able to get a listing of how many students, how many employees, how many janitors per school district that we have, so we can start planning on how to distribute that vaccine to those different schools. We've worked with the schools in the past to offer off-site testing clinics at their schools. We're going to be doing the same thing for vaccine clinics and utilizing those different schools. So we work with the educators and the superintendents and the Regional Office of Education nearly on a daily basis. And then again, the ramifications are, we don't want to put children in unsafe conditions. We want to make sure they're trying to follow the recommendations as much as possible and wearing the mask, as well as giving them the opportunity to learn. Again, it is up to each regulatory authority and each school district on how they handle that, but we absolutely encourage following State Board of Education guidelines and Department of Public Health guidelines for those distance, separation, and wearing of the mask and so forth.
Okay. Barb, just to take one step back real quick to vaccine, we're getting a lot of questions come in about an age group that we didn't really discuss much in that, but those 60 to 74, that's in that 1C group, correct? Not with the 75 and above in 1B, but they are in the next group, correct?
Yes. So persons in 1C are persons 16 to 59 that have comorbidities, and then persons aged 65 to 74 years of age are also in that age group in 1C.
Okay, so
Yes.
so 65 and above would be in that 1C.
65 and above is in 1C.
And then anybody below 65 without underlying health conditions is in that Phase 2.
That is correct.
Okay.
Yes.
Just want to make sure we clarified that. We were getting a lot of questions come in.
Okay.
We move into the next question here. This person says, please provide the industries that can test out of staying at home when a household member tests positive as an essential worker. Is that a grocery store worker, a maintenance worker, an airline worker? And does the employer decide, or is there guidance from IDPH that spells out who these essential workers are?
There are guidelines from CDC and IDPH who these essential workers are, and part of the need for those essential workers, if they're absolutely needed, if there's not enough police, there's not enough fire, individuals to cover the shifts, then those individuals that maybe, this is not who tested positive, these are only for those that may be quarantined, okay? That those are quarantined, that they can have test out of quarantine as long as there's no symptoms and they test negative. But again, that can be up to each individual business and each situation. So if there's a shortage of police, if there's a shortage of firefighters or those essential workers to, we as society, we have to have power and electric and water. Those essential services are the ones that can test out of quarantine, but they still need to follow all the rules for masking and social distancing.
Okay. A couple questions as it revolves around CDC changing guidelines for quarantine periods. One person asked, are you still recommending the 14-day quarantine for close contacts, or per the CDC's new guidelines, can you test out of quarantine if you receive a negative test result and have no symptoms? And a second person asked, why is IDPH not following the CDC guidelines on quarantine length of 10 days versus 14?
IDPH is following and allowing the 10-day removal from quarantine. We are following that as per CDC. We still recommend the 14 days. It is research has shown that you still can be a carrier for 14 days. So even if you have no symptoms at day 10, and you can then be released from quarantine, but you must make sure that you wear your mask and wash your hands and follow the rules. As far as IDPH is following the 10-day recommendations. As far as testing out of it earlier, the test needs to be done on day 6, and it needs to be a PCR test, not a rapid antigen test. It must be a PCR test to be able to test out on the 7th day or thereafter. So those are rather hard to come by within a day or two to get test results. 2 to 3 days is typically when you get your PCR test results. So most of the time, by day 10, you may have your 6th day test results, but they must be PCR. So, long and short is, if you have no symptoms, you can get out of quarantine at 10 days, but we highly recommend still going for 14 days or ensuring you're just being extra careful.
Okay. The next person says, a couple months ago you made a plea for people to contact the health department to help with contact tracing. I called and left a message in early November and never heard back. Do you still need help? And if so, who should I contact?
Absolutely, and I'm sorry if we missed your phone call because our phones are very busy. Please give us a call at the health department at 233-7703. And the requirements for a contact tracer, minimum of an associate's degree to be able to do this, and we're looking for full-time employees. We're looking for full-time at this point.
Okay, the next person says, yesterday a friend did a grocery pickup at Walmart in Belleville and was told that there were many people sick with COVID-19. The pickup was very chaotic. No one came to her car after an hour-plus wait. The phone was not answered and the voicemail box was full. She had to go in the store. Why isn't St. Clair County warning us about outbreak locations like this? Can we feel safe picking up groceries when there are so many people sick?
Well, one, we will definitely follow up with this individual. If you could call us, let us know which Walmart. This is the Walmart in Belleville. Okay, we will follow up with that. Number 2, we will ensure, and folks that are positive are required to stay home and isolate. We will ensure that businesses are following that. We contact those individuals that are positive cases, and we also issue letters to those individuals so they can take that back to work to show that they're not allowed to work. So we will definitely follow up with that and make sure everyone is following the rules as they should.
Okay, the next person says, why do restaurants in Clinton County have indoor dining but not St. Clair?
St. Clair County restaurants, we're following the Tier 3 mitigations, and we're doing this to try to get a hold of this COVID, to reduce the spread of COVID as much as we can. We're following the guidelines. These are scientifically proven tools that we have in our toolbox now with the masking, the social distancing, the closing of indoor dining, all of those are methods to help us control the spread of COVID, so we need to continue to do that.
Okay, the next person says, how do you get test results for tests taken at the 330 West Main site? I was given no information as to how to expect my results, and I'm now going on 5 days with no info.
Again, we're rolling this out. There should have been information given to you, and I apologize if that wasn't. I'll make sure we follow up with that. And if you did not get your info within 5 days, call the health department. We'll follow up with that for you. But I will ensure that I will check with our provider that's doing those services for the county and make sure that information is getting out to everyone. There should be an informational sheet with contact information that's being distributed. So we'll make sure that gets out.
Okay, the next person says, is there any plan to track and report the second variant of the virus, or is it included with the original numbers?
As far as reporting our daily numbers, those will be those that test positive. I know CDC and I'm sure IDPH will be following up on those tests that may come back that are this second variant of the virus, but in our daily numbers, we will be providing those that test positive.
Okay. And the last one that came in for the health department says, where are kids under age 1 contracting the COVID virus?
I'm sure it's from adults and from their brothers and sisters or teenagers. Again, this virus is in our community everywhere we go, so they too must be protected as much as possible and try to keep them home and safe as possible.
Okay, thank you. Chairman Kern, a question that came in here for you today, sir, says, according to the governor's plan, we can move into phase 5 when a vaccine is available. Is the county demanding clarification on how many vaccines need to be available for the governor to fulfill his promise?
So here's my view on this. You know, the positivity rate in the county today, 15.5%, 125 people, a record number in the hospital today. I'm sure that when those phases were rolled out, that it was done with an eye towards the fact that vaccine would help to bring that positivity rate down, given more and more people getting the vaccine. At the time that those recommendations were made, the federal government was promising that these vaccines were going to be rolled out. This was all going to be easy. They would have plenty of vaccine for everyone, and it would be a very quick process to get it out. Well, as we're seeing now, it's much slower than what was promised. We have a new site at 330 West Main waiting to go when we get vaccine to come into the county. So what we need now is more vaccine. And as we see the effect of that then on the positivity rate, then I think that we can look at rolling back and going back to where we were more open. But it would seem to me that 6.5% number of a regional positivity rate is still probably going to be a number that is looked at. We got to get these numbers down. No matter if a number of people have been vaccinated, which they have been in the county, and that's a great thing. We still have a record number of hospitalizations today. We still have an extremely high positivity rate, not only in St. Clair County, but in the region. Until those numbers get down, I think quibbling about a vaccine and whether the vaccine's available, so now we should immediately open up, I think is unproductive, and I don't think it is in the best interest of public health. Right now, we've got a crisis going on. We need to keep our eye on the ball, keep our foot on the accelerator. Let's get this vaccine in this county. Let's get it in the arms of people in 2 doses, and let's get this vaccine behind us so that we can move forward.
Thank you. Director Simmons, a question that came in says, have you given any thought to changing the tone of the messaging? For example, instead of calling out people who visited their family as misbehaving, how about thanking those that stayed home within their own household? Many studies have shown that positive reinforcement is more effective than criticism.
Well, everybody has their opinion on that, and we have tried it for 290 6 days now to get this message out there, and I think the chairman just summed it up in a nutshell there. This is a crisis, and people better start realizing that, as I sit here this afternoon, and I see several comments on here, not from the good members of Team St. Clair, from the people who still don't think this is real. Where you're living, I have no idea, and I really don't care at this point in time at 296 days. Record number of patients in a hospital. We've had the CEOs of the hospitals, we've had medical personnel on here, the doctors, the physicians, everybody that we can think of to come on here to try to get that message out to those who are the non-believers. If you get upset because we sound like we're stressed out and we're tired, you're right. That's probably the right thing that you're thinking. The virus isn't. I said that the other day. The virus is still here. You just heard Barb and the chairman say it's in every part of the county, every zip code, and until those who aren't taking it serious decide that it is, we have got a battle on our hands. This invisible enemy is going to be here until we get these numbers under control, and we do that by being a part of the solution, not sitting here worrying about us sugarcoating things. We can sit here and sugarcoat it, the result will still be the same. We are trying to get people to wake up and realize that this is serious. 330 people in our county aren't with us anymore because of this virus.
Okay.
That's a staggering number.
Yes, sir. And the last person, just a comment, says, thank you for all your time and hard work, St. Clair County EMA, Health Department, behind the scenes folks, translators, Spanish translators, all the guests and doctors that have come to the update. One huge thank you and virtual hugs to everyone.
Thank you to the person who sent that in. We appreciate that. Again, we're here for 296 days. We'll be here for day 297 tomorrow. Hopefully these numbers will go down in the right direction, and then we can all sit back and enjoy life the way we used to. We'll see you tomorrow afternoon.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.